Thank you. Thank you to all the speakers, and we hear your call for action. Thank you. And so moving on to CalFresh, I'm going to ask all the presenters. We do have a hard stop due to another required meeting, and as you can see, we are now a committee of one, so I would ask you to be very brief in your remarks so that we can ask a few questions and hear from the public. Mr. Bland, if you'd like to start off.
Thank you. I've got a handout the sergeant is passing out, and I'll try to be brief. On the first page of the handout inside is your CalFresh program in a nutshell. It is the formerly known as food stamps. It's an entitlement program that provides food assistance to low-income families. The program is essentially 100% federally funded for benefits, although the administration is a shared state, county, and federal. At the federal level, it's called the Supplemental Nutrition Assistance Program, or SNAP, and people access their benefits through the electronic benefit transfer cards that they can swipe at the participating retailers that are approved by the federal government. Turning to the next page, I have a short slide for you on CalFresh participation. The bottom line here is half full, half empty. California's participation lags that in the nation. This is the percentage of families that essentially, amongst those that are eligible, how many are actually getting the benefit. And California lags the nation. 83% is the national number. We're only at 63, although we did increase by 8 percentage points. This is old data, I would point out. This is from federal 2012, though it's the report that was just released by the federal government. It does reflect that we're moving in the right direction. Increasing CalFresh participation is a priority of the administration. We've had many things in place to increase that participation, some of which are administrative, some of which are statutory. There's things that happened after 2012 that aren't reflected here. I would say one of the largest is something the legislature did, and that is the wisdom of moving to semi-annual reporting, only having people turn in paperwork every 6 months instead of every quarter. With that change, we've essentially joined the other 49 states being like that. And that should increase participation, as people should be able to stay on the program longer. Further evidence that we think we're moving in the right direction, although again, I don't minimize that where we stand is not where we want to be. Since 2012, and you can actually flip over to the next page, we can do it kind of fast. We compare, basically, this is the caseload growth percentages in California versus the rest of the nation. You can see since 2012, California has continued to increase participation, while the rest of the nation actually had a mild decrease. We would hope, we can't be certain because the participation rate is a function of how many people are eligible. So we would hope that since our caseload kept growing, hopefully our eligibles as the economy is recovering are actually leveling off or slightly going down. We think we will make progress on that. But again, we do consider that a work in progress. It's not where we want to be. Another aspect of the CalFresh program is CalFresh outreach. We work with 8 primary contractors and 100 subcontractors. And as the slide indicates, we were responsible for rolling about another 118,000 in CalFresh last year. On the governor's budget, essentially what you have, and I think your agenda laid it out well, you by and large have a workload budget. We fully funded basically requirements of current law in terms of the administrative funding for the program. A few key features in that is continuation of the something we put in last year, the state utilities assistance. This allows 300,000 families to essentially draw an extra $60 a month in benefits due to the because they can essentially get the standard utility allowance. Something that we're going to be changing in the coming year is the elimination of change reporting. Certain households are actually on a more restrictive when they need to turn in report changes. Not many of them, but they need to report essentially monthly if their income changes by $50 or $100. And we would like them to basically be, as I mentioned, like the rest of the state, the semi-annual reporting. This is essentially a win-win proposal, and then it eases administrative burden for the clients, but also is easier to administer for the counties. Our caseload does contemplate and to some extent already reflects the Affordable Care Act, and people are applying for that and are enrolling in CalFresh as well. And we're also implementing one of the bills that changed the rules. It made it more friendly for students receiving the budget.
Could you give us your final comment, please?
Did you? I guess I would like to talk about our budget change proposal, which is not in the handout, but I would urge your support for our BCP. In the area of SNAP education, we have proposed 6 positions. They are 100% federally funded. SNAP Education is a partnership with the California Department of Public Health, Department of Aging, Department of Food and Ag, University of California, Davis, CalFresh. As part of additional oversight and of that program, as one of our partners, the California Department of Public Health, moves away from working with the Public Health Institute and instead hiring state staff, conversations that were had last year with the legislature, with the federal government, wanted increased oversight so that we could essentially do better management evaluation of the SNAP Ed piece of the program. We urge your support for the BCP.
Thank you. Ms. Bartholomew.
Hi. Thank you, Chairman. Jessica Bartholomew with the Western Center on Law and Poverty. Happy to be here. I have provided my comments in written format in order to truncate my verbal presentation. Just briefly, when we talk about child hunger and when we talk about child poverty, the reason why it's detrimental to the health of children is because children are going without their basic needs met, one of those being hunger. The research that has come out in recent years has shown that even one incident, just one incident of hunger for a child can impact their future life opportunities. And so it is a paramount goal of this state to make sure that children don't experience hunger. Period. And we're excited to work with the committee to achieve that goal, and also with the administration. The administration has taken the task of improving our CalFresh program and trying to improve participation. The recent numbers do show that. We have been happy to work with the administration and the county welfare directors over the last year to implement the Budget Act actions taken last year, which I want to mention briefly. First, to move to categorical eligibility. This helps working families. It moves the gross income test to 200% of poverty and targets families with high housing costs, earnings, and child care costs. It's exactly what we should be doing to reduce childhood hunger in the state. And we are working with the administration and the counties to improve the implementation of that policy. It was quick, it came quickly following the budget, and so hasn't been as smooth as we'd like to see. April 1st will be the implementation date of the repeal of the lifetime ban for people with prior drug felony convictions, provided they're participating with their conditions of probation and parole. And everything looks on track for this. I commend everybody involved. It has been smooth sailing. We'll let you know after April 1st if we can pat ourselves on the back. And finally, the implementation of the SUAs. Again, this was really great that California could step forward, both the administration and the legislature, to say that we will not implement the cuts that Congress sought. So that's all the good news. The bad news starts with 7 o'clock this morning, a hearing in D.C., which was the full Agricultural Committee to discuss the SNAP program. Having just signed, the president having just signed the Agricultural Act of 2014 with cuts and changes to the program already, we were hoping that would be the end of the conversation, at least with regards to cuts, and that the new Congress would come into town ready to discuss 16 million kids going hungry in the country and wanting to do something about that. Unfortunately, that wasn't the conversation in D.C. this morning. It was around work. So what I would like to do is invite the committee here and the legislature to continue conversations and bridge conversations with your colleagues in the higher education committees to look at their investments in work and work opportunity and training for very low-income people, including foster youth and former foster youth, people in reentry, basically any of our working poor who are underemployed, to see if we might be able to match that with 50-50 federal dollars in our employment and training program. This is an invitation from the federal government for uncapped federal spending to support employment and training for CalFresh recipients. This is my letter. So that would be the first invitation. And the second invitation is to help our administration and our counties be able to prioritize the use of the ACA CA 87 waiver. That's all technological, I guess, words for more money from the feds at a 90-10 match rate to help bridge our programs, reduce churn, increase efficiencies for our counties and for our families who are seeking aid. Those are invitations to lead. You don't have to put money down in order to do that. So that's, I think that's something that can be done with very, very little effort. And finally, I would just invite you to reach out to Western Center as technical assistance as you think about these issues and other ways we can reduce hunger, not just in the CalFresh program, but across the spectrum of anti-hunger programs that the state and federal governments work on together. Thank you.
Thank you, Ms. Bartholomew. Welcome, Ms.
I'll help you out.
Nzewi?
Nzui, yes.
Nzui,
Yes.
welcome. Thank you.
Thank you, Chairman Thurman. My name is Keisha Nzui. I'm from Alameda County Community Food Bank, and I'm really pleased to be here to talk to you about the State Emergency Food Assistance Program. The program was established in 2011 without funding, but for the last 2 years has been funded at the level of $1 million through gifts from the Assembly. But that funding is temporary. Now, it's proven to be a program that's very easy to administer, and it's a program that benefits not only food banks, but the 1 in 6 Californians who rely on food banks and our agriculture community, because the money that is used to purchase fresh fruits and vegetables can only purchase California-grown products. So it's a wonderful program that I want to illustrate why it's important by giving you a little illustration from my own food bank in Alameda County and that community. So when I joined the food bank in 2010, we were fresh off our 2010 hunger study, which found that we serve 1 in 6 Alameda County residents, and that year we served 19 million pounds of food. So we fast forward to today, where we have results from our 2014 study. Unemployment is down, the economy is good, things are bright and fresh, except for 20% of our Alameda County residents. Things have gotten worse. We now serve 1 in 5 residents. So if you imagine that the Raiders sell out and the Coliseum is full, and then it happens again in a season, that's how many people we serve each month. So things are really bad. How can this happen in one of the most prosperous areas of our state? Well, according to the California Budget Project, it takes $86,000 for a family of 4 with 2 working parents just to make ends meet. But nearly half of our client households make less than $10,000 a year, and 65% are under the federal poverty level. So that means that people are desperate. They're choosing between food and rent, or food and buying a new pair of shoes for their children, or food and medicine. And so many parents go without meals just so that their children don't have to go without meals. That means we have lots and lots of people going to bed hungry every night. So last year, our food bank set a goal to deliver 90 million meals per year by 2018. Now, most of that, well, a lot of that will come through actual food out of our door, out of our warehouse stores. Most of that will come through policy changes and administrative changes. And because we obviously can't do that alone. We can't do that just by giving out food. No food bank can. So the government-private partnership is paramount in order to end hunger. We've managed to keep up with this growing need between the recession and between this current year, but how much longer can food banks do that? Last year, our food bank received $28,684 in CFAP funding, but that meant we were able to provide approximately 65,000 meals to our community. This year, we're on track to deliver 30 million pounds of food to Alameda County. Compared that to the 19 million we did in 2010. So we're doing yeoman's work, but we can do better when we have support from the State Emergency Food Assistance Program. California is a great state, but we have the highest poverty rate, as you've heard over and over today, the lowest in CFAP funding. We can do better. We deserve better, and Californians are so worth it. So we're asking for permanent funding of the CFAP program and to fund it this year at the level of $5 million. Thank you.
Thank you. Mr. Ressa.
Thank you, Mr. Chairman, for having me today and inviting me to speak on behalf of 128 organizations who support the creation of a statewide nutrition incentive matching grant program. This program would use new federal matching funds from USDA to help us extend the CalFresh dollar so that clients are healthier on their pathway out of poverty. The Nutrition Incentive Matching Grant Program is built on the evidence-based success of a 5-year-old model that doubles the purchasing power of CalFresh benefits when spent on healthy fruits and vegetables grown by California farmers. It's a win-win for CalFresh clients, California farmers, and our state economy. In 2013, more than a third of Californians found themselves below 200% of the federal poverty line, which is the gross income cutoff for CalFresh. Approximately 42% of Californians below 200% FPL were food insecure in 2012. According to the CDC, 60% of Californians' adult population is either overweight or obese in 2013. People in poverty are also disproportionately overweight and obese, putting the state on the hook for healthcare costs for preventable diet-related chronic diseases. Overweight and obesity cost the state an estimated $26.9 billion in healthcare costs and costs associated with lost productivity in 2011 alone. To make matters worse, as Mr. Bland referenced earlier, California consistently leaves heaps of federal funding on the table when it comes to CalFresh and federal funding. If CalFresh reached 100% of all eligible individuals, we would inject $62 million of additional sales tax revenue into the state general fund and also $29 million for county budgets. But only 57% of eligible individuals receive CalFresh, which means we say goodbye to that additional $3.5 billion from the feds. Not only has the USDA shown that every dollar in SNAP expenditure generates $1.79 in economic activity, but our own LAO says that CalFresh benefits help generate revenue for the state and local governments. Ongoing evaluation of market match, which is the model that the Nutrition Incentive Matching Grant Program is based on, shows that demand for nutrition incentives far outweighs the supply and has very real benefits like a 6-fold return on investment and can lead to job creation in farming communities, boost county CalFresh enrollment, and promote healthier food shopping habits for CalFresh clients. But the statewide program has one big limit. Without institutional support, its reach and positive impact is limited by the support of private donors and foundations. This is why our budget proposal asks for a modest investment of $5 million per budget year for the Nutrition Incentive Matching Grant Program. California can't afford to leave any more federal money on the table, this time provided by the Food Insecurity Nutrition Incentive Program. And as Ms. Bartholomew mentioned earlier, the 2014 Farm Bill made a lot of cuts to SNAP, and this is one of the lone bright spots that we should take advantage of. We urge the legislature to take advantage of these federal matching funds to establish this statewide program, which can boost healthy food access and provide much-needed support to our farmers and farm workers who are struggling through the drought. Thank you for your time and attention, and we hope you find as much value in the program as the California farmers, CalFresh clients, and local economies. California is by far the nation's biggest producer of healthy fruits, nuts, and vegetables. This budget proposal would ensure that all Californians can afford to eat what we grow. Thank you.
Thank you, Mr. Rouse. Mr. Mecca.
Thank you, Mr. Chairman. Frank Mecca on behalf of the County Welfare Directors Association. Very quickly, CalFresh participation is a very high priority for the county welfare directors. We're pleased that we've been able to more than double the size of this program since the beginning of the Great Recession. It's terrible news that 2.5 million or so people needed to be added to the program, but we're pleased that we were able to add them. We're also pleased that the recent increases in our participation rate, it shows that the efforts that we're undertaking are working and that we're moving in the right direction. We're absolutely not satisfied, and we're not ready to rest. And every county in the state is diligently implementing a county-specific CalFresh participation plan, the bodies of which we can share with the committee rather than going into it right now. The last thing I'd like to say is Mr. Lightbourne and I were on a panel earlier in the year of CalFresh advocates, and the panel got asked a question. If you had a magic wand and you could do one thing in this program to increase participation, what would it be? Our answer to the question, the one thing that we could do if we had a magic wand, would be to allow for something called reverse express lane from the Medi-Cal program into the CalFresh program. Earlier in the year, last year, when every state was struggling to get as many people into Obamacare as possible. One of the things the federal government allowed us to do was to take people who are on CalFresh but who were not on Medi-Cal. And by virtue of the fact that we're on CalFresh, we took on faith that they're Medi-Cal eligible. We didn't require them to apply. We said, hey, you're on. Tell us if you don't want to be on. Otherwise, you're on. And we were allowed to keep those people on for a year, and then at which point we would then go through a normal redetermination. The single biggest thing we could do to increase participation would be to do the reverse. And the difference is the federal government, the Centers for Medicaid and Medicare Services, allowed us to do that, to put people on Medicaid. They did not, the USDA has not allowed us to do that, to put people in reverse, to put people on the SNAP program, on the CalFresh program. And so what we would like to see is an alliance of advocates in counties and the state legislature and the administration to have some kind of joint letter, some kind of effort to pressure the federal government, who are understandably sort of worried about California's participation, and spare few opportunities to let us know that it's a concern of theirs, to say the single biggest thing that we could do is now in your power. Let us do it.
Can you provide that letter to our office, Mr.
Absolutely.
Thank you.
We have a draft.
Yeah. I'm guessing, Ms. Bartholow, knowing how you work, it's already in my office.
Yes.
Let's see. Mr. Woolsey, anything from the LAO's office?
Chair, I just want to say that we have reviewed the SNAP-Ed proposal that Mr. Bland mentioned, and we're not raising any issues with it.
Thank you. Mr. Cook, anything from Finance?
Thank you, Mr. Chair. No further comments from Finance, but happy to answer any questions you have.
Thank you. I've got lots of them, but I want to hear from the speakers. Public comment. Anyone here for public comment? Please come forward. You have up to 1 minute. I'd ask, if you don't need it, please don't take the whole minute. We're trying to get you all in, and then we'll get to this meeting. Please.
Thank you, Mr. Chairman. Andrew Shane from the California Association of Food Banks. I just want to second the comments made by Keisha that the need for the CFAP program is truly statewide. But I would say that the food insecurity situation in the state is made worse by the drought. And just to highlight the comments made in the agenda by the staff, I do appreciate the clarification that the need for the Drought Food Assistance Program and the State Emergency Food Assistance Program are in parallel. They are separate programs. We can talk with your staff about the details of why that's the case, but these are indeed separate needs. We also do support the Nutrition Incentives Program. Thank you.
Thank you.
Brenda Diaz with the Latino Coalition for Healthy California, and we are in support of the Nutrition Incentives Program.
Thank you.
Kimberly Chen with the California Pan-Ethnic Health Network, also in support of the market match proposal. Thank you.
Thank you.
Alexis Fernandez with California Food Policy Advocates. I think we should build on the momentum that we've had over the last couple of years that's led us to this increased participation, and we encourage efforts to modernize the program to increase access, speed of benefit delivery, to increase dual enrollment. We are in support of all the budget proposals and would also like to put our support behind the Nutrition Incentives Program, as well as the emergency food funds for when CalFresh is simply not available. And we'll also sign on to that letter that Jessica has already written.
Thank you.
Good afternoon, Ellen Moy. I'm the Executive Director of the Pacific Coast Farmers Market Association. We operate 60 certified farmers markets in the San Francisco Bay Area. We've been participants in the Market Match program since 2010, so we can personally attest to the benefit that it has for California communities and California farmers. Over the past 3 years, we have seen the CalFresh spending in our farmers markets increase dramatically. Over $500,000 in spending over the past 3 years from low-income families who are increasing their consumption of fresh fruits and vegetables. Our studies have shown that 88% of that spending goes directly to California farmers, not to the other producers in the market. And because those farmers are growing in California, we know those funds are going back to our rural communities, our agrarian communities, where they are being reinvested into jobs and economic opportunity. So we strongly encourage the Assembly to give the Market Match proposal its full consideration. Thank you.
Thank you.
Hi, Kathy Mossberg, representing the Public Health Institute. Just want to go on record supporting both the Nutrition Incentives Program as well as the increase in CFAP dollars.
Thank you. Thank you, speakers, and thank you to all the presenters. Really 2 quick questions, and if you can answer just in a minute. And I'd like to start with a question about where we are with the SNAP program. And you mentioned, I think you said 57%. Did I get that right?
63 we're up to
63%.
in the latest. That's on the overall participation rate.
What's the issue that you see for why we're not at 100%? How do we get to 100%?
There are. I mean, it's hard to say why we lag. I think some of it is changes. Again, those are old numbers. That's 2012. We don't have the impact of semi-annual reporting yet.
Just hit me, if you will, with why something that is available to someone who is eligible, why it's not in their hands. Hit me with that.
If I could offer one comment, Mr. Chair. In addition to Mr. Mecca's statement of the need for reverse express lane, up until a couple of years ago, California fingerprinted every applicant for CalFresh. The message that sent, the image that created, the natural resistance that put in the community is something we're still trying to, even 2 years after we stopped the practice and the legislature voted it and the governor signed it, we're still untangling the negative cast we put on it.
Got it. Ms. Bartholomew.
Yeah, I'd just like to also add that while we're second lowest participation rate for the 2012 numbers nationally, we're the worst for participation among working families. And I think that we could help working families and our participation rate if we focus on them, on streamlining participation between the programs with CalWorks, CalFresh, and Medi-Cal, and make those programs work better together.
Thank you. Yes, go ahead.
I'd just like to add briefly, since we work in food systems and with the number of mixed status families we have here in California, immigration policies also have something to do with it, where maybe the parents are ineligible, but the children are eligible, but there are still other considerations like deportation that are on parents' minds.
And I want to riff off of what you're saying, Ms. Rose. I'm assuming that there is still some fingerprinting taking place that essentially is an impediment.
Well,
in CalWorks.
Director Lightbourne said there's no more fingerprinting, but there's still issues like, making your address known, or even stigma or worries about ICE coming to your house.
We'll be looking into it. Ms. Rouse, would you say a little bit more about the proposal that you were describing? I love the double bottom line benefit that we help those who are hungry and in need, and we support our farmers at the same time. Just give me a minute and just so I get it.
Yeah, so California grows upwards of 60% of the nation's specialty crops, which are fresh fruits, nuts, and vegetables. Unfortunately, most of the Farm Bill funding, the 2014 Agricultural Act, funds commodity crops, which are rice, corn, wheat, soy, cotton, not the crops that we grow here in California. So the advantage of these incentives is that we're essentially drawing down federal monies as well as what we can secure through public-private partnerships to actually provide CalFresh clients the price point to afford to buy these types of products. And then since the specialty crop farmers are California farmers, then that direct economic benefit goes back to those farms. And the study from 2013, as well as ongoing studies of the Market Match program, have shown that farmers have actually been able to add staff or add acreage even during this time of recession since the program started in 2009.
Mr. McGraw is here from my office. Could you provide the information to him so that I could review it after we get past this meeting?
Absolutely.
Thank you. Final word, former Assembly Member Dion Arender. Final word on the subject.
Dion Arender on behalf of no one, just myself on this one, just looking back, okay, as being the oldest person in the room probably, which I say very often.
Maybe the smartest. Go ahead.
Well, not that, but certainly the oldest. The other thing, which is an interesting point, and the folks at the table can confirm it or deny it, most other states didn't do what we did with CalWorks, right? When you look at the other states, what happened now, the safety net in other states happens to be food stamps, SNAP. Well, we still have a real safety net in our CalWorks program for all of the problems that we have with it, okay? And so when you look at the national numbers, right, that's all that's left in those other states, so that's what they use as their safety net. Well, we're fortunate enough that we use food stamps to supplement our safety net. Not that we don't have issues that we need to correct and all of that, but I think it's just an important point. We're being compared to states that have nothing left from what we used to know as AFDC.
Thank you, Ms. Arender. Clearly, we have hard work that must be done, but I am encouraged by the innovation and the great ideas that you all have presented to this committee. As you can imagine, this will be an ongoing conversation for us until we get it right. Thank you for your push. Thank you for your information. Thank you to all the presenters. Thank you to the public. Thank you, staff. This meeting is adjourned.